Let's discuss what exactly is ovulation, what exactly is female anatomy, and how really should anybody want a pregnancy or not want a pregnancy, work through it. As soon as a girl is born, let me tell you that we as women are born with a finite number of eggs. Unlike males, which have an infinite production of sperms, and that is why they are fertile not only at 40, at 50, at 60, at 70. Women finish their fertility cycle somewhere around 35 to 40 years. And my intent of telling you is also that much as you may want to delay fertility, you should also know till when can you wait and when is the hurry. Just to walk through the normal cycle, as I said, a girl is born with a finite number of eggs which start at puberty, developing into every month a monthly cycle, or menses as we call. So a lot of eggs start developing under the hormone of FSH, which is a pituitary hormone, and that instigates the eggs to develop and produce an endometrium or a uterine lining which is receptive to a pregnancy. As soon as, if there is no pregnancy, that is no intercourse, no contact, and in a young girl, the egg will rupture but will have not a place to get fertilized, and therefore under another hormone, that is in LH and progesterone, it develops into a corpus luteum which has a fixed 14-day cycle, and then if no egg, no pregnancy, one will start menstruating in the next 28-30 days. A normal cycle is anywhere between 28 to 35 days. Some people may have prolonged cycles, say from 35, they may have a 45 or a 50-day cycle, which is not really normal, and some people have a very short cycle. So less than 21 days, we call it a short cycle. More than 45 days, we call it a long cycle. What is important is to know that somewhere 14 days before the next cycle date is the date when one is really receptive to becoming pregnant. So if you want to avoid that date, that is the date to be avoided. 14 days, so mark on the calendar 14 days before the coming cycle. So if your cycle is 28 days, then you are exactly midway receptive. If it is a 35 days, then you are somewhere, say around 21 day. But if it is a 45-day cycle, so 14 days before the coming cycle is the day when one has to be careful for whichever way one is planning. So let us say you're planning to become pregnant. You may be in contact the whole month, but if you miss out on that very crucial day, that is 14 days before the coming cycle, then you would have missed the boat. So because the cycles are not so fixed, you can always be a 2 day this side or that side. So you have to be in contact if you want to become pregnant 2 days before or 2 days after. So those 5-6 days of the cycle are extremely important. However, if you want to avoid a pregnancy, again, these are the days when you should be careful and you should take all the precautions that are required if you don't want to get pregnant. However, for people whose cycles are not fixed and irregular, it will be difficult to use a dating method. In that case, we have many other methods like testing on an ovulation kit. So you get these kits in the market which are just like urine testing kits for pregnancy. The day you say you have a 28-day cycle, then say from day 9 or 10 when you start putting 3 drops of urine on the kit and you get one line. Second, day 10 again you test, you get 1 line. On day 11, 1 line. Day 12, 1 line. Day 13 you get 2 lines. Then you know that you are going to ovulate in the next 24 hours. So you have to be in contact. That means in the next 24 hours if you are trying to get pregnant. These are what are called the ovulation kit tests. These are homemade tests. You can test them at home. You need not go to the office of the doctor to get checked whether you are ovulating on and what is the right day of ovulation. And similarly, if you want to avoid, then you also know these are the days to avoid a contact. these are the other way, of course, is getting an ultrasound done, seeing how the egg is developing, looking at the size of the egg, the way it is coming up. The day it becomes 18-20 mm, we know it's a ripe egg ready to rupture, and if we give an injection for rupture, it will rupture in the next 36 hours, and then you will again be fertile to try pregnancy. So this is how a normal cycle works, and this is just to tell you, how to work either yourself or through a doctor if you are working through a menstrual cycle. Thank you.